show. I'm Haldi Jansen-Daubia. The COVID-19 pandemic has severely affected the world's people and their livelihoods. Healthcare workers are at the front line of battling the invisible enemy. In South Africa, more than 500 healthcare workers have succumbed to the virus, while public and private healthcare facilities are following strict virus mitigation guidelines. COVID-19 is exposing the inequalities at play in our society. COVID-19 is exposing the inequalities at play in our society and the weaknesses in delivering on healthcare systems. It is frontline healthcare workers, including community healthcare workers, who are the line of defense in tracking and tracing. They bear the brunt of an inefficient delivery of personal protection equipment and adherence to protocol measures to keep workers safe. The Western Cape is leading the national infection rate, followed closely by Gauteng. The failure of health systems in the Eastern Cape is putting an already overburdened system at greater risk. In today's show, we look at the situation and plight of community health workers who are also the front line in combating COVID-19.
Umsebenzi lo wabayikera kudala ndawuthanda ndikhula ndandikhale bayinesi, but unfortunately azange ndikwazi ke ukufunda ngenxa yemeko basasikhule sibaninzi ekhaya. Umuntu azophangela ke ngoku apha kwa-TB HIV care.
Endlovini umsebenzi wethu kukungena indlu nendlu sikhangela abantu abangasazityiyo iipilisi zabo abadefaultileyo. Sikwazi ke ngokuba siphinde sibabuyisele ekliniki umuntu akwazi uphinda uthatha iipilisi zakhe.
Umsebenzi wami endiwenzayo apha ndiyikhansela, ndiyabreaka, nditheste i-HIV, then ndi-initiate ndiqalise iipilisi abantu abafanele babaqala iipilisi.
Apha kwi-community umcelamngeni okhoyo ukuthi okokuqala i-safety asinayo. Iphinde futhi njengoba sihamba singena apha ezindlini le nditsho ndithi siyamkeleka kwezinye asamkeleki, kwabanye bafuna uba masingene ezigeyithini zabo. Njengoba ubona mos amatyotyombe siwasebenzayo amanye abiyelo, uthi ukhwaza umuntu akujonge nje sukavala ibhakile yakho kavala icango lakhe, asingeni ke kwindlu enjalo.
Most yabantu abadisclosanga ezindlini zabo. Ngoko ke ingxaki esibanayo kuba usuku ufike ngoku uhambisa ipilisi and i-distance esihambayo inde kakhulu, and ngoku ingxaki esikuyo le corona asiya noba xa sifika emzini siyayizisa okanye mhlawumbi siyayithatha, akho zinto zosikhusela.
Umqeshi ke yena ke andifuna uphosisa, it's a big issue because for thina sicinga akasikhathalelanga, because akasibuzi xa iza kwenza into uvelenze engakhange aqale kuthi azobuza uba ndinalo mbono endicinga uba mandiwenze ngolu hlobo nolu hlobo ngani.
Akanayo nento eke wahlala nayo phantsi nathi wathi njengoba sithi kuniphangelani ngeli xesha lale corona, ukuba unogula yicorona simazi uza kuthini. Sazi noba uza kugxotha kwaphela ngumsebenzi kugula ngoku okanye uzathi phangela ugula.
Asiyazi noba sasulelekile ngosihamba because akho nto isikhuselayo. Imask akunika yona, ukunika imask eyi-1 athi isebenzise for 7 days, ukunika ii-gloves eziyi-1, and aphinde axelele into yoba le mask awuyinxibi xa uhamba apha esithubeni, uzayinxiba only xa ufika kuloo mzi uya kuwo.
As a community health worker, I will say that the states have failed the community health workers. Remember, this is the time whereby community health worker should play the role that they used to play in the community. It is time whereby our government need to deploy community health workers to the community to educate the community about this new virus. But if the employer doesn't give out protective gear to the community health workers, what will happen to the safety of community health workers? Our MEC has spoken that he has trained 1,000 tracers who will be dealing with the cases of COVID-19.
Akho nto endiyaziyo ngecorona ngaphandle kwalo endiyivayo uba ithethwa, because khange sisuke training ya corona thina. kuve kwathiwa masiye efieldini qha siyophangela.
I-COVID-19 ndiyiva ezireyidweni ndiyibukela ezithivini. Eyona nto siye sayinikwa ke thina apha emsebenzini sinikwe ipemithi zoba xa siye sadibana namajoni okanye amapolisa abantu bezokhuselo sikwazi uproduce uba kuthiwa masiphangele. Asikho nto siyaziyo zange satreyinwa ngayo.
Ugovernment or uhealth akenzi kakuhle for mna ngokubona kwam. West kuthi thina zi-healthcare workers ingaski uba xa kukhona i-decision ayithathayo or into like umzekelo xa kukhona isifo esinje esithi gqi ingaske uba ube nokhathi xa izawuthatha i-decision akahlale nathi thina abantu baphangela apha elentukeni efieldini axela uba guys kunale ngxaki so thina singu-health sicinga uba masenzeni so nina benicinga uba makwenziwe njani angavele eze kuthi ezosixelela into yoba nanku umsebenzi yenzani.
To discuss this, we're joined by the Provincial Secretary of Nahawu in the Western Cape, Mr. Eric Waleta. Welcome.
Good afternoon and thanks for having me.
We're also joined by Ms. Martinique Marines, Provincial Manager for Vostesa in the Western Cape. Welcome, Martinique. We're also joined by Sally Malema, all the way down in Pretoria, National Organizer for SAFTU affiliate, the National Union of Public Service and Allied Workers Union. Welcome, Mr. Malema.
Thank you. Good afternoon. Thank you for having me.
And all the way down in cold Eastern Cape, we're joined by the National Union of Care Workers of South Africa, General Secretary, Ms. Nompumelelo Kapu. Ms. Nompumelelo Kapu. Welcome, Nompumelelo.
Thank you. Good afternoon. Thank you.
Thank you to all of you for joining us on this 2020 National Youth Day. We know that some of you are probably working, but thank you so much for joining us. Let's get into the discussion, and Nompumelelo, we're going to start with you. Before we continue, tell us about the care workers of South Africa and how they are managing during this COVID-19 pandemic.
All right, thank you. Community care workers are working to deal with HIV and TB, and they provide valuable services to our communities and social at large. We are suffering with several problems as carers. Problems include low wages, lack of labor rights, that most of us are working have caused. We are treated like as a volunteer. Sometimes we work without health and safety protection, no social protection, and benefits like retirement funds and medical aid and unfair contract of employment, and also abnormal PERSAL. We are not treated like professional health care workers, but deserve to be. We are so vulnerable workers. We try hard to fight and defend the community health workers against the exploitation at the hands of employers. Thank you.
Sorry, thank you so much for that, Nompumelelo. Sorry, can I bring you in here? Community healthcare workers, I would assume, are also part of allied health workers. What is NUPSA doing to ensure that in the COVID-19 moment, the most vulnerable of healthcare workers, such as care workers, such as level 5 to 6 to 7, even in the public sector, are protected?
Thank you very much. Look, as NUPSA, we have done so much in the struggle against the exploitation of the community health workers. we fought for the adoption of the policy, the current policy. Remember, CHWs were, for instance, being called names, caregivers, home-based carers, the volunteers, and so forth. We had to fight tooth and nail, have a meeting with former Minister Aaron Motsoaledi, who agreed to standardize the remuneration and also that they must be paid through a PESAL system. But we agreed to the standardization, but that was not our core demand. The reason why we agreed to the standardization is because, for instance, each province was doing their own thing. Some in Limpopo and Western Cape, other provinces, they were employed or outsourced to various NGOs. So we wanted to standardize, and we successfully managed to do that, except in the Western Cape, where the Western Cape is still behaving like a federal state, refusing to insource the community health workers into the health system. But
sorry, can I ask you just to press pause? I want to bring Martinique in here because I see she's got a bit of a smile on her face. I'm not sure she wants to respond to the point that you raised, that the Western Cape, in terms of the employment stability of community healthcare workers, seems to be going on another trajectory. Martinique, do you care to come in here?
Yeah, no, thank you. Yes, I can agree to what Solly was saying. This matter has been discussed at the council meeting, even at the chamber. This matter has gone to council itself, where the Western Cape is simply saying, we don't employ community health workers. Bottom line, we will not issue them with personnel numbers. They are not on our stats. They work for NGOs, NPOs. You see, that is the challenge. But currently now with COVID, now it's becoming now it's a different ball game. Now they're saying, you know what, we want to make use of the service. So we are saying, all of a sudden you want to make use of the service. Why can't you just, absorb them into your system? Because that's what we've been fighting for. Not only when it suits you now. Now you want to say, you know what, we bring them in, which is a bit.
Yeah, Martinique, let me bring Eric into this also because, and Eric, if I remember correctly, at the start of the announcement of the national disaster regulations, the community healthcare workers, of which, if I stand to be correct, there are almost 9,000 across the country, were going to be utilized for track and tracing. Can you comment on what Solly and Martinique has been saying, is that clearly the services of community healthcare workers are now needed more than ever. Eric?
Yeah, look, first and foremost, in joining the discussion around the significance of community healthcare workers, I must mention first, when they were introduced into the health system, it was precisely because there was a shortage in that particular area. And they then became a core function. So as they then became a core function, we could see how they were exploited as Nehao. In fact, we started this particular campaign before anyone else. That one, you can't have a community healthcare worker, a nursing assistant, a nurse working in the very same conditions. Then you classify the two as this one's are temporary and this one's not. So our first approach was that they must be absorbed into becoming government full-time workers, because ours was always that you've got vulnerable workers that have to care for those that needs that particular health care most. It means that that particular service will be compromised. And also they themselves were then at risk because they were not covered by any other policies that regulated those that worked alongside them.
Thank you for that. Nompumelelo, can we bring you in here before we go to our break? And if you could just, because all three the trade unionists with us have indicated that there is an opportunity to bring in community health care workers or care workers into the public sector, into a formal public sector employment contract. In your opinion, do you think that this is a battle that can be won given what COVID-19, the requirements of COVID-19?
In case of COVID, as a community care workers, we need to win that we suppose that the government absorbed us, because we are so suffering even when we go outside to work in the community. There are so many challenges and we are not safe at all, and we are so infected. Some of us are dying. Some of us are affected by COVID, but nothing the government doing for that. Ne? And the government, each and every time, they promise the carers that at the end of the month, next month, all the community care workers must absorb. But at the day that the month comes, the empty promises, right?
Thank you so much for that. We're going to take a break, and when we come back, we will continue our conversation about community care workers. Thank you. Welcome back. We're talking community healthcare workers and the COVID-19 pandemic. Martinique, I want to start with you. So in our previous segment, we explained the conditions under which community healthcare workers have been operating. COVID-19, a completely different kettle of fish, and it requires greater civil society, trade union, government partnership. What has been the responses from the hospitals and the hospital leadership and management that you've been engaging with around making sure that your members have the regulation PPEs?
We all know when it comes to PPE, and COVID, it's always a sore issue to touch on, where the employer is concerned. From our side, I can safely say from the Western Cape, they have been sufficient PPE has been supplied throughout the health sector. This is now mainly your hospitals, your facilities. But the challenge that we have is the accessibility to those PPEs, because now it's being locked up. So we ask, what's the purpose of something that needs to protect a worker being locked up? Then it serves of no purpose. You can have 1 million N95 masks, but if it's locked up, I mean, that's our challenge currently is, but throughout, even within DSD, there's been sufficient supply of PPE. I think what needs to happen regarding PPE is the how to put it on, the how to remove it. I think that is very, very crucial at this stage. As we can see, our numbers are increasing. We ask ourselves, but if members have been supplied with the PPE, how do they get infected? Where is this coming from? Is it because they did not receive sufficient training regarding on how to put it on and how to remove it? Because there's certain ways of doing things. So yes, that's all I can say for now regarding PPE.
Eric, I want to bring you in here. In our previous conversations on the Cape Town TV, Our City show, you indicated that there were particular public sector district hospitals that were in real danger. Frontline workers there, your members were in real danger. Here, I'm particularly thinking of Khayelitsha District Hospital, Mitchell's Plain, and Somerset. What have been your experiences with infection? And as Martinique says, the ability of healthcare workers to access and to use PPEs so that they can protect themselves.
Yeah, I think it's true indeed that the frontline workers are seriously at risk. A few weeks ago, when we had this discussion, we were still discussing their health and safety conditions, the access to PPEs. But now we are talking about bloodbath because people are dying in their numbers, let alone the patients and general citizens. We're talking about these frontline workers. So just to bring you on board, we consistently have had to go and fight with the department for the access to these PPEs, whether they are available or not, but our members have not been receiving them. So to access them, we either had to go with the workers outside and protest, then they will be available. Alternatively, we will have to go and lodge official complaint with the Department of Labor, which we've been doing. We were at Mitchell's Plain yesterday and Groteskir, and we were at Tigerberg and the other week, which all these inspectors have been really agreeing with us that the conditions of the frontline workers are unbearable as they continue to die on a daily basis.
Let's bring Sully into this. Sully, you're in a different part of the country, Pretoria. Is the experiences of your colleagues and comrades in the Western Cape the same in terms of particularly frontline healthcare workers struggling with access to PPEs?
Yes, we are experiencing, but the West is Western Cape, because what we are doing as NUPSO, we are having national sector committees where all healthcare workers across provinces are meet once a week to reflect on what is happening on the ground. But the reality is that, for instance, I'll give you, we will continue to have the surge of COVID-19 in the Western Cape. And I'm raising this based on these reasons. The CSWs in the Western Cape are outsourced to NGOs. NGOs are not providing proper PPE. I'll give you an example. St. John is the biggest NGO in the Western Cape. They are providing one surgical mask to be used a week. I mean, that is criminal. They are providing 750 ml of sanitizer to be used by more than 20 community health workers. There is no social distancing at their offices. So how do we manage, I mean, how do we, manage the surge of COVID-19 if we are having NGOs who are cutting corners to maximize profit? The issue of the neoliberal policies, that's why it's affecting us in Western Cape. Thank you.
Sully, that is definitely something that our editorial team will follow up on. I want to bring in Novo Molelo into this part of the conversation in terms of accessing PPEs for care workers, particularly in the Eastern Cape, which, as we've seen, have really been struggling under the additional burden of COVID-19. Novo Molelo?
We are not getting enough PPEs as a community care workers. When we're screening the patient, we use gloves, apron, and mask only. There is no gun temperature. There is a lot of problem because we are a target, and then we don't feel safe when you screen the person without knowing that how far temperature, you know, because there's no gun shooter for temperature. We use the mask, we use only apron, even the mask, you wear mask for 3 days because there's a shortage of mask. No aprons, some other facilities, there's no apron. Some other facilities, there's shortage of mask. That's a problem.
Thank you, Nompumelelo. Martinique, I want to bring you in here because you're the one who raised the issue of training. We are now going into possibly the 5th month. If we get through July, it will be the 5th month of a lockdown regulation tier system. Do you think that, particularly in the Western Cape, and we can all agree that the Western Cape right now is a hotbed, is a very, very vulnerable province in terms of COVID-19. Do you think that the current system of public health will be able to balance and manage the COVID-19 for the rest of the year, given that there are still chronic health conditions that the public healthcare system must take care of? Martinique?
Helga, no. From where I'm sitting, it's a no. First of all, you know, the effects that it have, the negative effects that it have on our members out there, it's that physical effect, you know, it's that mental, it's that psychological impact that it's already have taken its toll on members, because, you know, you have all these policies within the Department of Health, you know, are they really being implemented the way it should? And it's not happening. You know, we at that point, there's over 2,000 healthcare workers that's positive, that has been tested positive in this province alone. Now, we keep on reminding the employer, you know, before COVID-19 was even here, there was the shortage of staff. What's your backup plan? There is no backup plan, you know. So all of those, the members are burned out there. And I mean, half of the hospital staff is already on leave. The half that's left behind, you know, it's bad. The impact on them mentally, physically.
Martinique, when we come back, we're going to continue talking about this. Let's go to a break, and when we come back, we'll continue our conversation on community healthcare workers. Welcome back. Sorry, Eric, before the break, Martinique and I were talking about the pressures on the healthcare system, which we all know is already there before COVID-19. Eric, in your opinion, will our healthcare system be able to sustain the pressure of COVID-19 in addition to chronic health care, such as TB, diabetes, HIV, in the period ahead?
No, the upright question is no. And our view is that it's deliberate, because it's not only now with the arrival of COVID-19 that we've known that across the hospitals in the Western Cape, particularly in our communities, in order for you to access healthcare, even as much as you are having a headache, you must wake up at 3 to be standing in front of the hospital in 4 in the morning. So we cannot be making excuses for COVID-19. And this happens in a province where you've got an excess, in a surplus of almost R1 billion in its budget. And these things are not new. We've been raising it. For us, it has long ago collapsed. With COVID-19, it will put more pressure than what it already has. And my worry is, remember, the workers continue to go there to help those that are ill and those that are sick. Correctly so, as you said, we cannot only focus on COVID-19. There's a number of chronic illnesses that needs to be attended to in the hospital. But these employees are now at a point where they will decide that we are staying away because we are not safe. So that point will come when this virus reaches its peak, where you will find that 1,000 to 2,000 people die within the Western Cape alone. Then there will be no frontline worker that is prepared to go and throw themselves into the lion's den.
Sorry, can I bring you in here? Eric spoke about an almost deliberate, intentional agenda in terms of the unequal manner in which healthcare is provided. We're using the Western Cape, but can we extrapolate that to the rest of the country? Do you think that our 25 years of not making sure that there was equitable service is coming home to haunt us in this COVID moment?
Yeah, thank you. Yes, I mean, it is incontrovertible that the ANC government failed completely to improve the healthcare system, and they were caught up with their pants down on the issue of COVID-19. We've been raising the issue of NHI to say the government must expedite the issue of NHI so that the people of South Africa can experience equal healthcare system. But they have completely failed to implement the issue of NHI. So we are not ready, and the worst part is that healthcare workers, there's a huge shortage of healthcare workers in the country, and the government is now exposing the healthcare workers that we are having at this point in juncture. So how do we win this battle of fighting COVID-19 when all healthcare workers are exposed to the virus? We still have the issue of TB, we still have the issue of HIV and AIDS. So we are really in serious trouble. The government needs to do something about this. Unions in the country must come together and as a collective confront the government to do the right thing. As much as there's a fragmentation of the working class, we are not going to achieve a total liberation of the workers and the poor in the country. Thank you.
Martinique, I want to bring you in here because Solly raises a question around strategy. That the COVID-19 environment offers a unique opportunity to put pressure on the government in terms of healthcare and health system reform. We know that the relationships, no, did we not say that? I want to ask if OSPESA will open the door to do a unified kind of campaign with your co-unionists in the sector. Is this something that you would contemplate, particularly for the most vulnerable of healthcare workers?
Yes, no, I would agree with Solly. I think what needs to happen now is we need to collectively, obviously, we need to go to government and say, you know what? You need us. You need the community health workers. So until you absorb these guys into the system, we will offer our services. Because I think what's happening here is because they know this kind of sector, you know, they're vulnerable. They need this job. The majority of them consist out of women, you know. And for me, that is just another way of exploiting our women. You know, I want to thank you, Martinique. I understand that it is a vulnerable sector for a range of reasons, and there's a gender dimension. In terms of strategy, you know, the communities might say withholding services in this moment is perhaps goes against, you know, an oath and a promise to take care of people. But do you think that that is a last resort? I know that some members, some unions have threatened to take industrial action over accessibility of PPEs and keeping people safe. Eric?
Yeah, indeed, we do agree of the oath of serving. However, that oath alone should not be isolated by first and foremost ensuring that before as a soldier, you go and defend the country against a war. You yourself need to be thoroughly prepared and armed. So that on its own will become a competing interest, because the department is putting these healthcare workers in a situation where they'll have to choose between life and death. And these are breadwinners, these are family members, and these people, they must think twice, because they've seen that I've worked next to 1 and 2 for the past 30 years, but they've just disappeared now and succumbed to this particular virus. So until this thing is addressed, and it will need both the community, the unions, and all of us, because it cannot be a them and us approach between the community and the healthcare workers. The community needs to support the healthcare workers to be able to be capacitated enough to provide a quality healthcare service. Within this country, you've got just over 8.5% of a budget that is allocated to health. You've got evenly distributed, with the private sector just having more than 4 point something percent, but it services 16% of the entire population of the country. Yet you've got the other just less than 4.3, which is servicing 84% of the country. That is why we are going to continue to find this. And if the community understands this, then they will begin to understand why are our healthcare workers now finding themselves into a position that they must choose, that we are going and we are not. And what has been interesting, the people that have been making noise are the working class hospitals, Tygerberg, Grooteskier, but we've never heard about Constantiaberg, or we've never heard about these private hospitals, which are also substituted by government. So this, what COVID-19 has brought us is that we must make an assessment within the democratic dispensation. It really laid bare the conditions of our people, that indeed we have not really achieved where we want to be, which is a better life for all.
Yet, Martinique, as the private sector health workers have not been spared the danger and the impact of COVID-19.
Oh no, because we also have members in the private sector. They have their own challenges regarding transport, for example. Like your Gatesville Malamet, they have a lot of staff that tested positive. You know, fortunately, I was admitted in hospital a week ago in Gatesville Malamet, and I was diagnosed with pneumonia. Lucky it wasn't COVID. But the service that I've received as a person there, no, they are under pressure. The system, even in the private care sector, it's gone bad. It's really gone from, you expected to that you will receive a better service than the public health, but in fact, it's actually worse. I'd rather go to a public facility now than to enter a private healthcare. Even if you look at the infection rates amongst staff, your private sector, they are affected, very largely as well, your mediclinics, etc. We still have the challenge in the private sector, not just transport and PPE, but it's also the infection control. Because now it's a case of, we have seen the Department of Labor into certain private facilities. Now it's a case of, isn't there any other way we can sort matters out, No, because members comes first. So I'm not, and I always tell people, my job is obviously the safety of our members. I'm not here to cut deals. That's not us.
Martinique, sorry, when we come back, we're going to take a break now, but when we come back, we absolutely want to explore further, the discrepancies in the private sector, which brings us, which really informs the conversation about the NHI. I'm sure that Solly would have lots to say about that when we come back after the break. Welcome back. Solly, Martinique spoke about the conditions even in the private sector. It would seem that all these issues, all these struggles for health workers are coming together in this COVID-19 moment. Would you say this is a unique opportunity to further the national health insurance struggle? Solly?
Yes, indeed, this is the right time to expedite the implementation of NHI. But our only worry is that we are being led by looters. We are worried about if whether those who are at the leadership of those who will be responsible for managing that fund are not going to loot it. I just want to give you an example in the Eastern Cape. The Eastern Cape Department of Health just spent 10 million buying this, is it scooters? I don't know, scooters. And so how do you, because that thing cannot be regarded as an ambulance, because only the driver, how do you look after the patient while you are driving that scooter? So we don't understand the rationale behind that. So we are worried that the NHI, as much as is important, because all the citizens will have an equal health system, the universal health care system, it is important, but the challenge is the politicians who will go and loot the fund. That is our worry. But yes, we are in support of the NHI, and we want the government to expedite the process of implementing the NHI. Thank you.
It's really a pity that we have lost Mpumelelo. We seem to be having technical issues with the Eastern Cape. But Eric, let's bring you in here. Let's continue the conversation about the national health insurance in terms of strategy. Solly notes the danger of unethical practices in NHI fund. But in terms of strategy, particularly in a province like the Western Cape that has such unequal service delivery issues, how do you think we could potentially deal with forcing the hand for an NHI in the Western Cape?
Yeah, first and foremost, as staunch campaigners of the NHI, NEHAO has been the ones that has been running with it. And we are quite happy that over the past 10 years, no one wanted to listen to us. But now there's a green paper in Parliament. At least we are getting there, because we understand that had this taken care under a system of an NHI, we would have been capacitated enough as a country to deal with it. But when you speak of South Africa in its entirety, you must always know out of the 9 provinces, you've got eight provinces, and then you've got the Western Cape, which under the stewardship of the Democratic Alliance, they never recognized the NHI. In fact, the Western Cape was one of the identified provinces in the Southern Cape where there was a pilot site of the NHI. They disregarded that. They came with something that they called the MIP, Management Efficiency and Assistance Program, which they abandoned because they themselves could not really unpack and apply that. Now they are coming with something called universal health care or universal coverage, which it's something that they continuously want to counter what is the national standard. So it continues to play politics with the lives of people. We have had many issues, for instance, taken them up with the Department of Health nationally and said to the minister, how is it that in the Western Cape, you don't have sufficient staff within the health sector, but elsewhere we can see what you are doing? Then he continues to tell us in terms of legislation, he says this, and within the constitution, if you look at Schedule 4 and Schedule 5 matters where the premier of the province have got that entire right to make sure that they run things as they want. So that is the challenge, because he told us, look, he does not run HR. HR for health services are run in the Western Cape, but they continue to mislead our people and say, no, it's not us, it's the ANC government elsewhere, but it's the Western Cape that run the affairs of healthcare within the Western Cape. So if they are claiming to be the best run province, look at how exposed they are. We've gone through the length and breadth of this province. Rural Western Cape, as far as Maritzburg, where you can see the appalling there's not even hot water in the hospital set up. Now, currently with the COVID, how then do you think those particular hospitals survive? Yesterday, we got a call from the Dorrance Hospital. Ironically, so we had a meeting on Friday with management that within that rural community, the CHC there, the only community health center, they had 5 staff members that were found positive, but the institution don't want to subject them to test and everything. We sadly learned yesterday that someone else passed on amongst the staff member. So that on its own is the Western Cape. It does not have the interest of the poor, continues elevating these policies that are neoliberal and serving only a particular class. Until we deal with that, then we are continuing to be staying in this particular dump.
I want to bring Martinique into this conversation. Martinique, scathing critique of the way in which the Western Cape Department of Health and the Western Cape government deals with health provision, particularly for vulnerable communities. I know that Hospesa, you know, you're a professional organization to represent nurses, but has this been, what has been your experience as a trade union engaging with the Western Cape Department of Health in terms of providing equitable health care and as an equitable employer?
Look, we have engaged them at numerous times, but now what we're faced with currently is the testing criteria, because the Western Cape have changed their testing criteria to say, you know, below the age of 55 with comorbidity, etc. Now we are saying, what about those walking out there, the undiagnosed TB and HIV? What about your pregnant woman? Are they not regarded as vulnerable? You know, who is the Western Cape to deviate from World Health Organization standards? The Western Cape must be mindful that they are part of South Africa. They're not the Republic of the Western Cape, you know. They are a province within the country. And that is really a challenge for us, because we are saying, okay, so they are prioritizing testing for only a specific category of people, which is fine. Prioritize testing for my healthcare workers, it's fine. Then what about my poor? What about the poor communities? They can't afford medical aid. So the Department of Health is blatantly saying, you know what? We only test a certain category. If they want to be tested, they must go to private hospitals, which is a bit unfair, you know. It's, I mean, they are poor already, you know, in these conditions, you know. Now, what are they saying? Must you come forward if you stay in, like where I'm staying in Hanover Park? My neighbors doesn't even want to go because my neighbor feels I'm below the age of 55, but I don't have a comorbidity, but I've got all these symptoms, but I'm not hospitalized. So will I be denied the access to healthcare? So we are telling this Department of Health, Western Cape, you know what? For you to put a specific category of people who can have accessibility to healthcare, you are trampling and infringing on the rights of the poor, which is not, you know, which is not right, and that should be looked at. The same with the NHI. We're saying it is an opportunity for the NHI to kick in, because the Western Cape Department of Health is saying we'll rather pay the private sector 16,000 rand per day per bed, and also the issue of the backlog, because NHLS can't take the capacity anymore. So if NHI was in place, there would not have been this differentiation of I can go to pet care and MPAT and you must go to NHLS. We would not have been faced with this challenge of the backlog. So those are all the issues. I'm saying Western Cape Department of Health is not immune to legislation. They don't have the right to tramp on other people's rights. You know, the same with schools are reopening. So are you saying my child's got the symptoms, my child does not have the right to get tested? Is that what you're saying with the criteria? Because basically, if something should happen to my child at school, and God forbid a child doesn't die, you know, or passed away, as government's failure to provide that right, I won't leave it like that. As a mother, you know.
Thank you very much, Monique. We're getting to the end of our show now, and I want to ask each of you the way forward within the COVID-19, and I'm going to have to give you 10 seconds or less. I want to ask each of you the way forward for your individual organizations in this COVID-19 moment, in the interest of your members. Solly, let's start with you.
Yeah, thank you very much. Our position as NUPSO is that we cannot leave the status quo remain. We are mobilizing, we're planning for rolling mass actions, and you might see starting from this Friday, rolling mass actions across the country in a fight for a total liberation of the CHWs on salary level 5, in a fight for a demand for COVID-19 danger allowance for CHWs, in a fight for a proper PPE for all healthcare workers. So we are also fighting.
Thank you very much, Solly. Eric, over to you. 10 seconds.
Yeah, for us, we are really starting now to become irritated with the department. Earlier sometime in April, we contemplated taking them to court, but as things unfold now, we are exploring that alternative of taking them to court because people are dying as a result of their own irresponsibility.
Martinique?
Okay. From USPASA side, you know, we at that point to say, you know, let's come together. Let's do this. Let's do this as a, you know, as one unit. Unions, employer, workers, community. Our call out there is, you know, help us. We even educating our members to say, you know, first take care of yourself, you know. But we can't win this thing unless we're in this, because we are in this together. So
yes, thank you so much, Martinique. Thank you to all our guests. I want to just say that we have continuously tried to get that Nopubulelo couple out in the Eastern Cape. The connectivity was just an issue. Thank you to Solly, Eric, and Martinique. Continue with the good work that you've done. We wish you all the best for your members in the community healthcare and in the healthcare sector. And to you at home, thank you for watching. Till next time.